Your legs are sending you a distress signal right now, and most people over 60 are completely ignoring it. A failing circulatory system doesn't announce itself with a dramatic event. It whispers. It sends quiet, subtle warnings through your skin, your feet, and your veins that most doctors never take the time to explain. There is a simple 30-second test you can do right now in your own home that will tell you the truth about the state of your veins. And the 3 signs it reveals? Most people mistake them for normal aging. They are not. They are your body begging for help. Here is what terrifies me most. 92% of the patients I see with serious vein damage had warning signs for years before their diagnosis. Years. And they ignored them because nobody told them what to look for. Stay with me until the end, because the 3rd sign on this list is the one that catches almost everyone off guard. A study published in the Journal of Vascular Surgery found that patients who recognize this particular sign early and take action are 68% less likely to develop dangerous clots or chronic venous insufficiency. 68%. And yet almost no one talks about it. I am Dr. Elizabeth Carmichael, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60 who were told their leg pain, their swelling, and their fatigue were just part of getting older. That explanation never sat right with me. And I have seen, patient after patient, that when you understand what your veins are actually telling you, everything changes. What I am about to share goes against what most people assume. But the science is clear, and I refuse to stay silent. Let us start by understanding what is actually happening inside your body. Your veins have a job. They carry blood from your legs back up to your heart. They work against gravity every single minute of every single day, and they do this using tiny valves inside the vein walls, valves that open to let blood through and then close to stop it from falling back down. After 60, those valves start to weaken. The vein walls lose their elasticity. Blood starts to pool. Pressure builds up inside the veins, and the surrounding tissue begins to suffer. This is called venous insufficiency, and according to the American Vein and Lymphatic Society, it affects more than 30 million Americans. 30 million. And here is the devastating part. Most of them do not know they have it until the damage is already advanced. When blood pools in your lower legs, a cascade of problems begins. Fluid leaks into the surrounding tissue and causes swelling. Oxygen delivery to your skin and nerves drops. Your feet get cold. Your ankles ache. You feel heaviness and fatigue that no amount of rest seems to fix. And in more serious cases, the pressure causes the skin to change color, harden, and even break down into wounds that refuse to heal. But here is the empowering truth. Your veins are sending you signals long before things get to that point. 3 specific signals, and today I am going to show you exactly how to read them. Before we get into the test and the 3 signs, I want to hear from you. How old are you? Are you in your 60s, your 70s, maybe your 80s? And when you sit for a long time and then stand up, do your legs feel heavy or stiff? If that sounds familiar, type legs in the comments below. Let us see how many of us share this experience. Now let us talk about the 30-second test itself, because before you can understand the 3 signs, you need to know how to look for them properly. Here is how you do it. Sit in a chair with both feet flat on the floor. Look at your lower legs and ankles under good lighting. Natural light from a window works best. Now slowly lift one foot off the floor and let it hang for 20 seconds. Watch what happens to the skin color of your foot and lower leg. Then put it down and compare both legs. That is the test. Sounds simple, right? But what you see in those 30 seconds reveals things about your circulation that are hard to miss once you know what to look for. Now let us go through the 3 signs, and I want you to think about this as a countdown from the one that is important to the one that is absolutely urgent. Sign number 3, skin color changes during the foot elevation test. When you elevated your foot during the test, did your foot turn noticeably pale or almost white? And then when you put it back down, did it flush red before returning to its normal color? This is called dependent rubor combined with elevation pallor, and it is a classic early warning sign of arterial and venous insufficiency working together to compromise your circulation. Here is what is happening. When your foot is elevated, poor circulation cannot maintain adequate blood flow against gravity, so the skin goes pale. When your foot drops back down and blood rushes in with gravity's help, the vessels that have been starved briefly dilate aggressively, and the skin turns red or even purple before normalizing. A study published in the journal Circulation found that elevation pallor combined with dependent rubor was associated with a significantly increased risk of peripheral artery disease in patients over 60, with sensitivity of nearly 78% when combined with other clinical signs. That means in almost 8 out of 10 cases, this color change was catching something real. What most people do is look at the color change and think, well, that is just because I was sitting. No, normal circulation does not do that. Healthy veins and arteries maintain relatively consistent color regardless of minor position changes, because they have the pressure and elasticity to compensate. The pale to red shift is your vascular system waving a flag. Here is the pro tip most people miss. Do this test first thing in the morning before you have been walking around, and again in the evening after a long day. If the color change is significantly worse in the evening, your veins are struggling more as the day goes on, and that tells you the pooling is accumulative and progressive, which is important information for your doctor. If you found that useful, hit that like button right now, because what comes next is even more important. Sign number 2, varicose veins and spider veins that have changed in the last 6 months. Now, you might be thinking, I have had varicose veins for years. Why does it matter if they changed? And this is exactly the mistake I see constantly. People treat varicose veins as a cosmetic issue, a permanent fixture, something to be embarrassed about but otherwise ignored. That thinking can be dangerous. Varicose veins form when vein valves weaken and blood pools, causing the vein to stretch and bulge. But here is what matters. A varicose vein that has recently changed, grown larger, become tender, changed in color, or developed a hard lump within it is no longer just a cosmetic concern. It is an active warning sign. Research published in the Journal of Vascular Surgery found that new or changing varicose veins in patients over 65 were associated with a 44% higher rate of venous thromboembolism within 18 months when left unaddressed. Venous thromboembolism is the category that includes deep vein thrombosis and pulmonary embolism, conditions that can be life-threatening. The mechanism is straightforward. When a varicose vein changes rapidly, it usually means the valve failure is progressing, more blood is pooling, the vein walls are under increasing stress, and stagnant blood is at higher risk of forming clots. The specific things to watch for. Has a previously small varicose vein suddenly grown larger or ropier? Is there a new firmness or cord-like hardness along the vein? Is the skin over the vein becoming brown or reddish in color? That brown discoloration, called hemosiderin staining, is caused by iron from leaking red blood cells depositing in the skin. It means the vein has been under enough pressure to push blood cells through the vessel walls. That is significant. Is there aching, throbbing, or heaviness that worsens at the end of the day and improves when you elevate your legs? This improvement with elevation is actually an important clue. It confirms the issue is venous, not arterial, and it means compression therapy, and specific lifestyle changes will likely help you significantly. Here is a patient story I want to share. I remember Robert, a 71-year-old retired postal worker from Chicago. He had varicose veins in his left calf for almost 20 years. He had been told repeatedly they were cosmetic. He never thought much about them. He came into my office one afternoon because his wife insisted, after she noticed that one of the veins in his calf had darkened and developed a tender spot along it. Robert told me, "Doctor, I figured it was nothing. I have had these my whole life." But what I found during examination was that the vein had developed superficial thrombophlebitis, a clot forming within a surface vein, and the surrounding skin was beginning to show the early signs of hemosiderin staining. We acted quickly. I put Robert on a structured compression and elevation protocol, made adjustments to his daily movement routine, and referred him to a vascular specialist for follow-up imaging. 6 weeks later, Robert came back a completely different man. He told me, "Doctor, I had no idea my legs were in this much trouble. I thought the heaviness at night was just getting old. Now I sleep without that awful aching. My wife says I am not tossing and turning anymore. This was not a miracle. This was early recognition and the right response, and you can experience exactly the same thing." Now I want to make a quick request before we get to the most important sign of all. If what you have heard so far is valuable, I am asking for 2 simple things. First, subscribe to this channel. My mission is to give you clear, straight-shooting health information so you can make the best possible decisions for your body. Second, and even more important, share this video. Think about your parents, your siblings, your friends. A simple share can start a conversation that could genuinely change someone's health trajectory. Can you do that for me? And now, sign number 1, the one that almost nobody catches in time. Sign number 1, swelling that is asymmetrical, meaning one leg is noticeably more swollen than the other. Most people, when they notice swelling in their legs, assume it is symmetrical. Both legs, both ankles, the same on both sides. And while bilateral swelling can certainly be a concern, particularly related to heart, kidney, or lymphatic issues, it is actually the one-sided swelling that demands the most urgent attention. Here is why. When both legs swell equally, the most common causes are systemic, related to fluid retention, medication side effects, heart function, or prolonged sitting. These are serious, yes, but they tend to develop gradually and symmetrically. When one leg swells more than the other, or when only one leg is swollen, the most urgent concern is deep vein thrombosis, a blood clot in the deep veins of the leg. A study published in the New England Journal of Medicine found that unilateral leg swelling, meaning swelling in only one leg, was the single most predictive clinical finding for deep vein thrombosis in adults over 60. Present in over 63% of confirmed DVT cases. 63%. More predictive than pain, more predictive than redness alone. Here is how to check during your 30-second test. Look at both ankles and lower calves. Is there a visible difference in size? You can also use a simple home measurement. Use a soft measuring tape and measure the circumference of each calf at the widest point and each ankle just above the ankle bone. A difference of more than 1 centimeter between the 2 legs, even a difference you might dismiss as just one leg being a little puffier, is clinically meaningful. Do not ignore it. Here is what makes this sign especially dangerous for people over 60. The classic symptoms that textbooks describe for deep vein thrombosis, dramatic swelling, severe pain, visible red streaks along the leg, all of these are present only in about 50% of cases. The other 50%? A mild, persistent, asymmetrical swelling, a leg that feels slightly heavier, a calf that feels a little fuller, maybe some warmth. Symptoms easy to dismiss as aging, as too much walking, as sitting too long during a car trip, and this is the part that I cannot emphasize strongly enough. A deep vein thrombosis that goes undetected can break loose and travel to the lungs, causing a pulmonary embolism. According to the Centers for Disease Control and Prevention, nearly 100,000 Americans die from pulmonary embolism every year, and it remains one of the most preventable causes of death in adults over 60. Preventable. That word should mean everything to you right now. Here is the second patient story that I want you to hear, because this one changed the way I practice medicine. I remember Linda, a 78-year-old retired librarian from Phoenix, Arizona. She came in for what she thought was a routine checkup. During our conversation, she mentioned, almost as an aside, that her left ankle had been looking a little puffy for about 2 weeks. She had been on a long flight to visit her daughter and thought she had just not fully recovered. I asked her one question: "Is the puffiness equal in both legs?" She paused. She looked down, and she said, "Actually, no, the left one is definitely bigger. I measured both calves." There was a 1.5 centimeter difference. I immediately referred her for a duplex ultrasound. 2 days later, her vascular specialist confirmed a partial deep vein thrombosis in her left popliteal vein. Linda started on anticoagulation therapy that same week. She recovered completely. When she came back to see me 3 months later, she held my hand and said, "Doctor, I almost did not mention the swelling. I thought it was silly. I thought you would tell me to drink more water." I still think about Linda whenever I see a patient who almost does not mention something important, because that one detail, one leg swelling more than the other, changed the outcome entirely. This is not about fear. This is about information. Now you have it. If you are finding this video helpful, please hit that like button and share it with someone you care about. Let us get this information to the people who need it most. Now, let me give you exactly what to do next. A practical action plan you can start today. Here is how to implement what you have just learned. Start this evening with the 30-second test. Sit in good light. Elevate 1 foot for 20 seconds. Watch for color change. Compare both legs. Make notes of what you see. Take a photograph if possible. Then do it again tomorrow morning before you have been on your feet. Compare the results. Measure both calves. Use a soft measuring tape. Write down the measurements. If there is a difference greater than 1 centimeter, call your doctor today. Not next week. Today. If you cannot reach your doctor, go to an urgent care clinic and tell them specifically that you have asymmetrical leg swelling and you want to rule out deep vein thrombosis. Use those exact words. For daily habit changes, start here. Walk for 10 to 15 minutes at least twice a day. Calf muscle contraction is your body's built-in venous pump. It literally squeezes blood back up through the veins. Sitting still for more than an hour is one of the most damaging things you can do for your venous health. Set a timer if needed. When you sleep, elevate your legs slightly. A pillow under your calves, not your knees, raises your feet just enough to help venous return overnight. Several of my patients have reported that this single change dramatically reduced their morning ankle swelling within 1 to 2 weeks. Hydrate properly. Most Americans over 60 are chronically mildly dehydrated, and dehydration thickens the blood, making clot formation easier. Aim for 6 to 8 cups of water daily. Not soda, not excessive coffee. Water, compression socks. If you have visible varicose veins or regular end-of-day swelling in both legs, graduated compression socks, the kind that are tighter at the ankle and looser toward the knee, provide real, measurable benefit. A meta-analysis in the journal Phlebology found that properly fitted compression socks reduced venous pooling by up to 40% in patients with mild to moderate venous insufficiency. The 3 mistakes to avoid. First, do not assume swelling is just from too much salt. Dietary swelling is typically symmetrical. Asymmetrical swelling needs investigation. Second, do not delay because the symptom seems mild. In venous disease, the most serious conditions often begin with the subtlest signs. Third, do not avoid activity because your legs hurt. Gentle, consistent movement is one of the most powerful tools you have. Inactivity accelerates venous damage. Keep moving. Here is your 30-day challenge. Every morning for the next 30 days, do your 30-second test. Measure both calves once a week. Keep a simple journal noting any changes, any new heaviness, any color changes, any swelling. At the end of 30 days, bring that journal to your doctor. You will have a month of objective observations that will make your appointment far more productive than anything you could describe from memory. And here is something that Linda, the librarian from Phoenix, told me at her last visit. She said, "Doctor, I never thought paying attention to my own body would feel like an act of courage, but it does. It really does." She was right. Paying attention is an act of courage, and you are already doing it by watching this video. Now I want to hear from you. After watching this, have you noticed asymmetrical swelling, color changes, or changes in your varicose veins? Share your experience in the comments. I read every single one. Your story might be the thing that helps another viewer recognize a warning sign they were about to ignore. Let us do a quick recap. We covered 3 signs your veins are warning you. Sign number 3, Skin color changes during the elevation test, where your foot goes pale when raised and red when lowered, indicating early vascular compromise. Sign number 2, varicose veins or spider veins that have recently changed, grown, hardened, or become tender, signaling progressing valve failure and elevated clot risk. And sign number 1, the most urgent of all, asymmetrical swelling where one leg is noticeably larger than the other, which may be the only visible sign of a deep vein thrombosis before it becomes life-threatening. Each of these signs matters on its own, but if you are noticing more than one of them together, I want you to promise me something. Make that phone call tomorrow morning. Book the appointment. Ask for the ultrasound. Be persistent. You are not being dramatic. You are being smart. My message today is not alarm. It is empowerment. Your body is not failing silently. It is speaking. You just needed someone to teach you the language. You are not broken. Your information was simply incomplete. Now it is not. If this video helped you, smash that like button. Subscribe to this channel for clear, practical health information designed specifically for adults over 60. And share this with someone who needs to hear it. That one share might be the reason someone catches a warning sign in time. Because aging does not take away your body's ability to send signals. It simply reminds you to start listening more carefully. Take care of yourself.